Misery Rules in Shadowland is a newspaper article that Mike Gorman, a reporter for the Daily Oklahoman, wrote back in 1946. Having received numerous deeply disturbing complaints about the poor practices and shameful state of Oklahoma's state mental hospitals, Gorman took the time to make an extensive 2 week long fact finding tour of all of Oklahoma's state mental hospitals. The article that he ended up writing, Misery Rules in Shadowland, would quickly go on to become one of the most influential pieces of writing to ever be shared regarding the cruel, calamitous, and inhumane operation of state mental hospitals in general back in the 1940s. Indeed, an expanded version of the article, retitled Oklahoma Attacks Its Snake Pits, was featured in the nationally distributed Reader's Digest publication in 1948 and thus shared throughout the entire country. The reporter, Mike Gorman himself, would go on to become one of our nation's greatest, most effective mental illness and mental health care crusaders throughout the entirety of the 1900s. And this 1946 newspaper article is still relevant today for two reasons. One, it provides a very in-depth, very honest, and very rarely seen first-hand account of our nation's mental health care system during this sad period of our nation's history. And two, this newspaper article is directly responsible for setting into motion a subsequent chain of events that would ultimately end up culminating in our nation's very first community-based outpatient mental health care center. Opened in Oklahoma in the late 1960s, this first center would go on to serve as the initial blueprint for all of the community-based outpatient mental health care centers that today dot the map throughout much of our country. One small aside before we begin, though. At times, Gorman quotes national healthcare figures to show how far behind Oklahoma was from the rest of the country in this regard. In all honesty, I don't know where he gets these figures from because throughout my own extensive studies and research, and sadly, the manner in which he portrayed Oklahoma was actually very consistent for the rest of the country during this time period. And again, this is one of the reasons why this 1946 article continues to be historically relevant today. Misery Rules in Shadowland, Part 1. Not enough doctors, not enough nurses, not enough toilet paper, not enough covers for cold nights. When the laundry did not get around to the wards in time, there were not enough sheets and not enough pillowcases. There wasn't enough of anything but patience. This is a quotation from The Snake Pit, the current bestseller about life in a mental institution. Could be applied almost whole hog to the conditions under which more than 10,000 mentally ill Oklahomans exist in the 6 mental hospitals run by the state. At the 3 major hospitals for white insane, the Central Oklahoma State Hospital at Norman, the Eastern Oklahoma State Hospital at Veneta, the Western Oklahoma State Hospital at Fort Supply, And also at the State Hospital for the Negro Insane at Taft, the State Hospital for Mental Defectives at Enid, and for the epileptics at Pauls Valley State Hospital. The story is an unbelievably shameful one. In the last 2 years, the nation's press and other agencies have turned a bright light of publicity on the barbaric condition under which most of the mentally ill in America live. Today, despite the fact that the care, treatment, and prevention of mental disease is universally recognized as America's #1 health problem, advances in this field have lagged far behind those in general medicine. In many ways, the treatment of our mentally ill is little better than in the times when they were chained in cages and kennels, whipped regularly at the full moon, and hanged as witches. Surgeon General Perrin of the United States Public Health Service has recently said that at least 8 million persons are suffering from mental maladjustments. He added that although mental illness strikes more persons than infantile paralysis, cancer, and tuberculosis combined, more money is expended on any one of these physical ills than for all the mental diseases. How does Oklahoma fare in the national picture? Until this reporter embarked on a 2-week survey of our mental institutions, there had been no recent study of our 6 major mental hospitals. In 1935, the Brookings Institution covered the state hospitals in a report severely critical of our provision for the insane. In 1937, the Oklahoma Planning and Resources Board, in a bulky 150-page tome, assailed the overcrowding and undermanning of every one of our state mental hospitals. In that same year, the National Mental Hospital Survey Committee, at the request of Governor Marland, engaged in a 2-month comprehensive combing of these same hospitals. The findings were an indictment of our state's care of these unfortunate people. Yet conditions today in all of these mental hospitals are even worse than at the time the various reports were issued. A large percentage of patients in Oklahoma's mental institutions today do not receive psychiatric treatment. Most of them do not receive even adequate custodial care. More serious than anything, a large number of them could now be living happy, constructive lives as cured persons. Instead, they are wasting long years in institutions for lack of adequate care. Item by item, here is a brief analysis of conditions then and now. Number 1, overcrowding. In 1937, the National Mental Hospital Survey Committee pointed out that 7,199 patients were jammed into wards which had a total bed capacity of only 5,475. This represented 31.5% overcrowding. Oklahoma's neighboring states had an overcrowding figure of only 3.1%, while the national average was 11.2%. Today, the situation is much worse, with the overcrowding figure closer to 50%. The Norman Hospital is the most overcrowded, with 2,844 patients cramped into space for 1,793. Veneta has 2,653 patients for its 2,200 bed capacity. Fort Supply has 1,603 patients for its 1,154 bed capacity. Taft has 800 patients for its 700 beds. And Enid, the hospital for the mental defectives, has 1,250 patients for its 800 beds. And with the increasing admission rates, overcrowding grows worse each month. Number 2, shortage of doctors. In 1937, there was one doctor for every 339 patients in Oklahoma's mental institutions. But the American Psychiatric Association in 1925 established a minimum standard of at least one doctor for every 150 patients. So, according to its professional standards, each doctor in a mental hospital in Oklahoma had approximately 250 more patients than he could possibly handle. Today, the situation in Oklahoma is one of the worst in the country, with one doctor for every 525 patients. Norman, with 5 doctors for the 3,384 patients crowded into its main buildings in Lexington Annex, presents the depressing picture of one physician for about 700 patients. Veneta has 5 doctors for 2,653 patients. Fort Supply, 4 doctors for its 1,603 patients. Paul's Valley has 1 doctor for its 314 patients. And Enid, with more than 1,200 mental defectives, hasn't even one doctor on its grounds. In addition to all this, the Oklahoma State Department of Health has established a minimum standard of one psychiatrist for every 30 patients who are acutely ill. There are several thousand patients in the acutely ill classification in Oklahoma. Mentally ill people who, with the proper treatment, might be restored to their homes. If you have an appetite for depressing arithmetic, figure out for yourself how far Oklahoma falls short of this minimum standard set by its own health department. Number 3, shortage of nurses. In 1937, Oklahoma had 11 graduate nurses in its state mental institutions, one of the lowest figures in the country. Today, with several thousand more patients in its institutions than in 1937, Oklahoma has 7 graduate nurses. 5 are at Norman, 3 of these on a temporary basis, and 2 at the hospital for Negroes at Taft. Both Veneta, with 2,653 patients, and Fort Supply, with 1,603 patients, cannot boast the services of one single graduate nurse. The state health department has set up a minimum standard of one graduate nurse for every 4 acutely ill mental patients. Again, if you possess an appetite for gruesome figures, divide Oklahoma's 7 nurses into 2,000 acutely ill patients. And while you're at it, don't forget the 8,000 chronic patients who need nursing care too. Number 4, shortage of attendants. In 1937, Oklahoma had 501 ward attendants for its 7,278 mental patients, for an average of one attendant for every 145 patients. The absolute minimum set by the American Psychiatric Association is one attendant for every 8 patients. With monotonous regularity, we have to repeat, it's much worse today. Norman, with 89 regular attendants for 3,400 patients, has 37 patients for every attendant. This is close to a 500% overloading figure, one of the most disgraceful in the nation. Veneta, with 101 attendants for 2,653 patients, and Fort Supply, with 85 attendants for 1,603 patients, are a little better off. For acutely ill patients, the state health department has set up a minimum requirement of one trained attendant for every 6 patients. That would mean approximately 340 attendants for those 2,000 patients alone. Yet the state doesn't even have enough attendants to approach this requirement, and once again, we're excluding the 8,000 chronic patients. Number 5, state expenditure for each patient. Back in 1937, the National Mental Hospital Survey Committee laced into Oklahoma because of its miserly appropriations for the mentally ill, pointing to Oklahoma's low annual expenditure of $168.52 per patient. The report stated Oklahoma has lower per capita expenditures than all of the comparable states, it being lower than the average per capita expenditure for the Southwest Central region. The per capita cost in the comparable states varies between $321 and $358, or about twice the per capita cost in Oklahoma. A comparison of the expenditures for salaries and wages indicates that Oklahoma lags farther behind the comparable states in expenditure for these items. It was bad then, but it's much worse now. Latest figures available from the Department of Commerce show that in 1943, Oklahoma's appropriation was $201.84 per patient, against a national average of $335.84 per patient. At Norman, the average monthly expenditure in 1943 was $16.87 per patient. That same year, prisoners at the state penitentiary at McAllister were appropriated $24.18 a month, while patients at the Eastern Oklahoma Tuberculosis Sanitarium at Tallahena were appropriated $57.52 a month. Number 6, early treatment for mental illness. In report after report, Oklahoma has been lambasted because it has provided no facilities for the observation and treatment of mental illness during its early stages. Yet today, despite all this criticism, Oklahoma does not possess one bed in the entire state where a person can go for observation and treatment. Hundreds of borderline cases, which might be cleared up in a few weeks, are forced into institutions to which they are committed as insane. And despite the fact that the American Psychiatric Association has suggested the use of mentally ill instead of insane, Oklahoma uses a commitment form which uses the word insane 4 times on just the first page alone. Most states have a psychopathic hospital which receives all cases of mental illness for first care, examination, and observation, and provides short, intensive treatment for incipient, acute, and curable insanity. Although as far back as 1936, plans were formulated for a 50-bed psychopathic ward at University Hospital, Oklahoma today lags far behind other states in the early treatment and cure of mental disease. Number 7, lack of treatment in state institutions. In the last 15 years, tremendous strides have been made in the curing of mental illnesses, mainly through the use of newly developed shock therapies. In most states, the old idea about the insane being incurable has gone by the boards. The emphasis in these modern state institutions is upon the cure rather than mere custody of mentally ill patients. In Oklahoma, the old custodial idea prevails in most institutions. Only at Norman are all 3 types of shock treatment given, and these only to a limited number of patients. Both Veneta and Fort Supply rule out insulin shock treatment as too costly and too long. Although reams of modern psychiatric literature point to the efficacy of insulin shock in treating schizophrenics, it is hard to estimate the cost to Oklahoma because of this false economy. Patients who might be cured at a cost of a few $100s become chronics who cost the state thousands over a period of years. As Albert Douche, author of The Mentally Ill in America, puts it, nobody knows how many curables have been rendered hopeless by the nightmarish trials of state hospital life in the wards of many institutions. Number 8, lack of occupational, recreational, and diversive therapy. In recent years, thousands of mentally ill patients have been helped on their way to cures by supervised work and recreation programs. Most modern psychiatrists agree that the worst thing in the world for a mental patient is for him to be left idle and alone to brood about his imagined ills. In all of Oklahoma's mental institutions, this most necessary form of therapy has been neglected. Though the State Department of Health requires both an occupational and recreational therapist for every 30 patients, there are only 3 occupational therapists in the state and over 10,000 patients. And there is not one recreational therapist. In Oklahoma, the lowest form of recreational therapy, the daily walk, is denied to practically all patients. As a result, fortunate patients sit on hard benches staring at the walls. The unfortunate ones are locked up. Number 9, excessive use of restraint and seclusion. In past centuries, mentally ill patients were restrained by a variety of barbaric mechanical devices. 20th century psychiatry has been almost unanimous in its condemnation of these various devices used to limit the movements of patients. The State Department of Health stated unequivocally the use of mechanical restraint is to be avoided. By this standard, Oklahoma is far from having the best hospitals, despite the fact that the camisole or straitjacket and the restraining sheet are the only forms of mechanical restraint permissible. Our state institutions use leather wristlets, locked belts around the body, leather locks around the legs, and many other devices. Practically every doctor in the Oklahoma mental hospitals is opposed to this excessive use of restraint, but explains it is sadly necessary due to the shortage of attendants. Seclusion means locking a patient up in a room for a specific period of time. Dr. Clarence Bellinger, superintendent of the Brooklyn State Mental Hospital, wrote recently, "I don't believe in seclusion rooms. They are calculated to turn anybody, sane or insane, into a wild animal." Dr. Bellinger has over 3,300 patients in his overcrowded institution, yet not one person in seclusion. At all major Oklahoma mental institutions, seclusion is widely practiced. In addition, there is widespread violation of the provision that the maximum period of seclusion should not exceed 3 hours. And finally, number 10, old age patients in our institutions. Back in 1916, Dr. F. M. Adams, then and now superintendent of the mental hospital at Veneta, wrote, "The tendency to commit aged and feeble-minded persons and paupers to the hospital instead of caring for them in their homes and county poor farms still exists. This is an imposition on the state as it keeps the hospital crowded, and the care that these patients take should be given to the mentally sick." In 1937, the Marlin Report criticized the overcrowding of our state institutions by seniles. Today, it's much worse. This list of 10 major deficiencies merely scratches the surface. It doesn't take into account the many shortcomings of the State Board of Public Affairs in its outmoded supervision of all mental hospitals. It doesn't point out the fact that Oklahoma does not possess one child guidance clinic designed to diagnose and treat the behavior problems of childhood, forerunners of mental breakdown in maturity. Further, it doesn't even begin to suggest the frightful squalor that these unfortunates live in. Beds jammed against one another, holes in the floor, gaping cracks in the wall, long rows of hard, unpainted benches, dirty toilets, dining halls where the food is slopped out by unkempt patient attendants, and above all, the terrifying atmosphere of hopelessness in institutions where thousands of patients are pinned in day after day, night after night, endlessly staring at blank walls. Veneta patients lack modern care. Eastern Oklahoma Hospital at Veneta, which handles the mentally ill from the eastern counties of the state, was opened in 1912 with Dr. Felix M. Adams as superintendent. Dr. Adams has guided the Veneta Institution through the 34 years of its growth and development. The site is excellent and the surroundings are pleasant. There are trees and flower gardens and good walks between the buildings. Unlike Central State at Norman, the Veneta Hospital buildings were constructed from a uniform architectural plan, and the results are good. The buildings are all brick, efficiently fireproofed, and, for the most part, in good physical shape. Veneta is the least overcrowded of the three mental institutions for the white mentally ill. There are 2,653 patients for its listed bed capacity of 2,200 beds. The wards are also in better shape than those in any of its sister institutions. Of course, the inevitable overcrowding exists, and in many of the wards, the beds are jammed very closely together. However, there is excellent cross ventilation in most of the wards, and there is a commendable absence of dirt, falling plaster, and persistent flies. Dr. Adams, who is exceedingly conscientious about the physical upkeep of the wards, has introduced many improvements in the Veneta Mental Institution. Instead of forbidding looking benches, he uses hundreds of rocking chairs throughout the wards. As a substitute for the usual white hospital bedspread, he has introduced gaily colored spreads in pink, yellow, and green. This may seem like a minor frill, but on the contrary, it might be an important item in lightening up the wards and influencing the mental attitudes of his patients. Eating facilities are also better at Veneta than at Norman or at Fort Supply. There is an enormous central cafeteria which feeds male and female patients in separate sections. Patients use compartmented metal trays and go through the serving line in cafeteria style. Kitchen facilities are excellent, with stainless steel ovens and pots and the latest in dishwashing equipment. Compared to over 1,000 old persons at Norman, there are only 250 at Veneta. Dr. Adams has been opposed to elderly persons clogging his institution and has kept the admission rate to an absolute minimum. The wards for elderly persons are the worst at Veneta. Sanitary conditions in these wards is reminiscent of the situation at Norman. Veneta also has a serious mental defective situation. There are 344 mental defectives at Veneta, considerably more than at either of its sister institutions. These mental defectives are not insane, as that word is commonly defined, yet they are committed to Veneta as insane. The mixing of these low-grade mentalities with the mentally ill is a throwback to the days when barbaric methods were used to care for the mentally sick. However, Northern Oklahoma Hospital at Enid, which cares for the state's mental defectives, is so overcrowded that it cannot admit any more patients. There are no graduate nurses at Veneta, and it's hard to exaggerate the effect of this upon Veneta's 2,600 patients. Back in 1937, the National Mental Hospital Survey Committee lambasted Veneta because it only had 5 graduate nurses. It's not hard to imagine what they would say about the present situation. There are 101 attendants at Veneta. And while this is considerably better than the situation at Norman, it is still far below the national standards set by the American Psychiatric Association. As at Norman, the attendants, swamped with excessive patient loads, are unable to give each individual the proper attention and care. Due to the shortage of attendants, there is much restraint and seclusion at Veneta. When this reporter toured the institution, more than 100 patients were in varied forms of mechanical restraint, and another 50 were in seclusion. This is exceedingly high. In addition to its regular attendants, Veneta employs 60 patients as attendants. Many of these are used as kitchen help and in the serving of the food, and the situation is just as depressing as it is at Norman. One part-time dentist. There is no full-time dentist at Veneta. One dentist comes in from the city of Veneta a few hours a week to handle the dental needs of 2,600 patients. According to minimum national standards, there should be at least one full-time dentist in every mental institution. Its clinical and pathological facilities are considerably below state and national health standards and inferior to those at the larger hospital at Norman. It does not possess one laboratory or x-ray technician. However, it is in the therapeutic treatment of its 2,600 patients that Veneta shows its most serious deficiencies. At Norman, despite the smallness of its medical staff, a sincere effort is being made to use all modern therapies in the treatment of mental illnesses. At Veneta, the emphasis is upon custody rather than cure. Dr. Adams is an exceedingly efficient administrator and continually points out how much he is saving the state through his modern bakery, his carpenter shop, and other aids. Dr. Adams uses only one type of shock treatment at Veneta: electric shock therapy. He said that electric shock was the most effective of all the shock treatments. He also insisted that it was the least troublesome and least expensive of all the shock therapies. Dr. Adams seemed unimpressed by recent studies at various mental hospitals which indicated the efficacy of insulin and metrazole shock in certain types of mental illnesses. Psychiatry is still in its infancy, and psychiatrists in the major mental hospitals are still groping with every known therapy in their attack upon mental illness. Electric shock is new. Electric shock is the newest of the shock therapies, and the returns are not in on its effectiveness. It is considered by some psychiatrists to be successful in the treatment of manic depressives and involutional psychotics, but most psychiatrists do not recommend it for schizophrenics. A large body of psychiatrists are distrustful of electric shock, claiming that it produces a deceptively quick recovery which does not last. Unfortunately, though, Inadequate appropriations by the state legislature are responsible. If Dr. Adams had an adequate medical and nursing staff, he unquestionably could achieve better results. Norman, with its small staff, has shown a rare adventurism in attempting to use all three types of shock therapy under the most adverse conditions. And the therapies auxiliary to shock treatment, Veneta is also weak. There are 6 tubs of hydrotherapy in the hospital, but they are seldom used. Dr. Adams is unconvinced of the effectiveness of hydrotherapy, and there is no trained hydrotherapist at Veneta. There is just one occupational therapist at Veneta for 2,600 patients, and the number of patients participating in the work is small. Diversive therapy is not used, while recreational therapy is limited to a daily walk and a few ball games for a small number of the patients. Psychotherapy, intensive analysis of individual case histories, is not practiced because of the shortage of doctors. With the absence of any young doctors on its staff, Veneta points up a dangerous situation in Oklahoma's mental institutions. Because of the low pay and the lack of treatment and research facilities, no young blood is coming into the state's mental hospitals. Oklahoma's mental institutions are cut off from the stream of medical research, and because we do not possess even the psychopathic hospital where internship in psychiatry might be practiced, we are not attracting young doctors trained in the latest psychotherapeutic methods. Young doctors are going to mental institutions in other states where they will have adequate facilities to work with, or to Veterans Administration, where they receive much higher pay and are closer to the streams of medical research. Unless there is a change of state policy, when our present crop of doctors burns itself out, our state mental hospitals will be without competent psychiatric staffs. Despite the fact that back in 1937, the Marland Report stated that hospital facilities would have to be doubled and, in some cases, tripled to make up for deficiencies and care of future increases anticipated by 1960. Successive boards of public affairs have done nothing about this situation. Fort Supply Mental Plant is weak in all phases. Western Oklahoma Hospital at Fort Supply, opened in 1908, is the oldest of the state's mental hospitals. Unlike its sister institutions at Norman and Veneta, which have been fortunate in having but one superintendent at the helm since the beginning, Fort Supply, undergoing a current series of administrative upheavals, has had 7 superintendents since 1908. Dr. John L. Day, the present superintendent, has headed the institution since 1934. Taking into consideration overcrowding, condition of its buildings, size of medical staff and treatment facilities, Fort Supply is not only the worst of the 3 mental hospitals for whites in the state, but it is perhaps one of the worst in the country. There are 1,603 patients at Fort Supply for an estimated bed capacity of 1,154. A high overcrowding figure. Bed space is at such a premium that beds have been squeezed into porches, day rooms, and even adjoining the hydrotherapy tubs. The condition of the wards is below minimum state and national psychiatric health standards. Broken wooden floors, cracked walls, and falling plaster are the rule rather than the exception. The beds are all badly in need of paint jobs. The toilet facilities are even worse than those at Norman. Ward 9, housing 50 men in a wooden, highly flammable building constructed in the 1880s, has been condemned more than once by the state fire marshal as a serious fire hazard. Ward 6, housing 65 elderly women, has been found by the engineer for the State Board of Public Affairs to be in a dangerous condition for use as a dormitory and ward building. And so on down the line. The eating facilities are unappetizing and unsanitary. In the main dining room, the wooden floor is badly cracked, ventilation is almost non existent, and the patients sit jammed together on long, hard benches trying to beat swarms of flies to the food. Patient attendants serve in sloppy fashion, and the eating utensils consist of battered tin plates, bent cups, and ancient cutlery. Food called adequate. The central kitchen would, or should, give our State Board of Health nightmares. Foot-long gaps in the floor, broken pipes, steam kettles from the late 1880s, a shed-like ceiling which keeps out all air. These are some of the highlights. The medical staff at Fort Supply is insistent in its claim that the patients receive an adequate and varied amount of food. But many criticisms have come to the State Board of Affairs in the last few years charging underfeeding of the patients. In touring this institution, this reporter was continually brought up short by its unkempt conditions. Rags and dirty linen were left in the oddest places, and in one hallway there was a pile of filthy mattresses, all torn up and obviously beyond redemption. The effect of these conditions upon a new, acutely ill mental patient can be acute themselves. Dr. H.L. Johnson, assistant superintendent at Fort Supply and a prolific writer on how things should be in mental hospitals, states in his standard practice manual for use in state hospitals for mental disorders, the manner of a patient's induction into the hospital may greatly influence the entire course of his institutional life. The surroundings being strange to him may incite disgust, fear, or antagonism. Patient load excessive. The medical staff at Fort Supply consists of Dr. Day, Dr. Johnson, and 2 assistant physicians. Dr. Day, a kindly, soft-spoken man, is an experienced and competent psychiatrist. Dr. H.L. Johnson, the assistant superintendent, has been at Fort Supply since 1929 and is widely known throughout the state. Dr. G.H. Orrick, at Fort Supply for 6 years, has had no training in psychiatry. And Dr. G.H. Glulo, who joined the staff this year, has had 30 years of general practice in Tulsa. Each doctor has approximately 599 patients to care for, an impossible load. There are no nurses on the staff and no laboratory or x-ray technicians. There are 85 regular attendants at Fort Supply, considerably below the standards of the American Psychiatric Association. Dr. Johnson, in his previously quoted manual, lays down a whole series of rules governing the conduct of attendants. As an example, he, the attendant, should not betray such illiteracy as to misuse the word tenant for attendant. Nor should he address the physician as doc instead of doctor. Most attendants at Fort Supply, having 80 or 90 patients assigned to them, have little time to worry about such forms of address, however. Of the 3 shock therapies, electric shock is the only one given at Fort Supply. Dr. Johnson pointed out to this reporter that during the previous week, he had given electric shock therapy to 4 patients. This compares with 60 patients receiving electric shock at Veneta and to several hundred patients receiving all 3 types of treatment at Norman. There are hundreds of acutely ill patients at Fort Supply. Therapies are neglected. The therapies relating to shock treatment are almost completely neglected. There are tubs for hydrotherapy, but no one seems to use them. There is one occupational therapist. There is little diversive or recreational therapy. Psychotherapy is practiced on a limited scale. And perhaps this is fortunate. Outside of Dr. Day, who is bogged down in administrative duties, only Dr. Johnson is trained to practice it. There is not one single social worker at Fort Supply for its 1,600 patients. Dr. Day and the present administration place too much emphasis upon economy. Earlier this year, Dr. Clarence Mitchell, an experienced psychiatrist, resigned from the Fort Supply staff because he was refused drugs which he needed in the treatment of patients. He is now at Norman, well satisfied with the situation there. Figures compiled at Norman show that it is cheaper in the long run to spend a few $100s trying to cure a patient than thousands of dollars paying for a lifetime of custody. The Fort Supply Hospital is the end result of years of neglect of our mentally ill by successive state boards of affairs and state legislatures. In every case of statewide neglect like this, one horrible example always receives a large share of the criticism. The major weaknesses of Fort Supply did not originate at that institution. They started at the state capitol, where indifferent legislators and administrators have practiced economy in the treatment of the mentally ill in Oklahoma. Subscribe to the A Tourist in the Land of Reason YouTube channel for more mental health and mental illness related videos. And follow us on Facebook for updates on new videos and sneak previews.